Hello guys, welcome to Pajon Imaging Hub. In today on how to do series on radiographers, health professionals, education series, we'll look at diagnosis of pericardial effusion in chest X-ray. Please don't forget to like, share and subscribe to this channel so that you'll be notified when new video is released. Thank you. Welcome back. Pericardial effusion is the accumulation of excess fluid in the pericardial space. We'll look at radiographic signs. What are the things we'll look out for in the radiograph, chest X-ray, to be able to make this diagnosis? The first thing is we'll look at the shape of the heart, globular shape, what we call water bottle appearance. Then we'll check whether there is epicardial fat pad sign or Oreo cookie sign. Then the widening of the subcarinal angle. There may be other signs that can point to diagnosis of pericardial effusion, but these three signs are more specific. Before we look at images of pericardial effusion, it would be nice for us to compare pericardial effusion and cardiac enlargement, which we call a cardiomegaly. They are not the same, even though the appearance will look like both of them are cardiac chamber enlargement, but a pericardial effusion is not cardiac enlargement. So look at what are the differences. And pericardial effusion, look at the shape of the heart will give you a water bottle or globular shape. But in cardiomegaly, you can have a chambers enlargement. All the chambers are different chamber enlargement. We discussed chamber enlargement in last week, so you can check the videos in the series and find chamber enlargement and go through it. The chamber enlargement can give or gives different shapes depending on the chamber that is enlarged. Then clear in pericardial effusion, we have the lung is clear, and there may be pulmonary oligemia. Your blood vessels will not be that prominent. But in cardiomegaly, in case of most of the cardiomegaly associated with cardiac heart failure. So you have features of CCF, cardiac congestive cardiac failure, pulmonary congestion, that is pulmonary edema. You see some of these signs in cardiomegaly. Then in pericardial effusion, there is hilar structure obscuration. The hilar doesn't look prominent compared to cardiomegaly, where you have a hilar stroke vascular prominence. And this is the Oreo cookie sign, epicardial fat pad sign. In cardiomegaly, you may not see that. The Oreo cookie sign is appreciated in lateral chest X-ray. The other difference is that in pericardial effusion, the increase is more rapid. You see the heart enlarge, the whole thing become enlarged within a short period of time. But in cardiomegaly, it is not that rapid comparably. So if you look at previous films, you'll be able to detect, you can add evidence to what you've gathered that this one is cardiomegaly compared to pericardial effusion. So let's look at some images. This water bottle appearance, you can compare it to the heart, and you see they look similar. So this is pericardial effusion, in case of pericardial effusion. Then the Oreo cookie sign, the epicardial fat pad sign. Then the pericardial effusion is accumulation of fluid in the pericardial space. So this Oreo cookie sign. Let me enlarge this image. You see, you look closely, you see two lucent line. One directly behind the sternum and one just above the anterior part of the heart. I use something, a label, to separate the red line and the blue line. The red line represents the epicardial fat. That is the epicardial fat sign, and the blue line is the pericardial fat behind the sternum. So that is the Oreo cookie sign. Then you look at the comparison of pericardial effusion and cardiomegaly. The first image here is a case of pericardial effusion. You see, there is a pulmonary oligemia. You cannot even appreciate the vessels. They are not prominent. The hilar is not prominent. But you look at the lungs. Lung field is clear. It's not crowded with vessels. But you look at this cardiomegaly, case of heart failure. This is a case of right ventricular enlargement. You can see the convexity of this side. If you remember the last lecture we did, I talked about this convexity here that is bulging out here. So you see the hilum, you see it's enlarged. You see it's prominent. The vessels are prominent. See, the vessels are prominent compared to these ones that you can't even appreciate the vessel very well. So this helps to differentiate pericardial effusion and cardiomegaly. Then the Oreo cookie sign. Still, the image I showed you, you can still appreciate the lucent line, but here you cannot appreciate the double lines that I showed you. I forget to let you know that the lucent line, what is between the opacity there, that is between the two lines, is the pericardial fluid. So you see, you can appreciate it here, but you cannot appreciate any pericardial fluid here. Thank you. Please like, share, and subscribe to this channel. If you like what you heard and you want to hear more of similar lectures like this, then subscribe so that you know when new video is released. Thank you. Bye for now.